Welcome to Retrain the Brain for Chronic Illness. I'm your host, Madeleine Lowry, a neural retraining specialist, helping people with chronic symptoms and conditions find real relief through advanced methods of neural retraining. In today's episode, we're exploring how the MAP method, a powerful subconscious neural retraining technique, can work hand in hand with conventional medicine. My guest, Dr. Alia Paquette, is both a practicing medical doctor and a certified MAP practitioner. She was my client for a few years before she trained in MAP herself and has been a guest on my podcast several times. Dr. Paquette bridges two worlds, the science of Western medicine and the wisdom of mind-body healing. In this conversation, we talk about how MAP complements medical care, accelerates recovery, and empowers patients to take an active role in their own healing. In this clip, Dr. Alia Paquette talks about how she contemplated returning to medicine after a 2-year leave due to her own health issues. During this time, she and I had been working together using MAP neural retraining sessions to aid in her recovery. And through this experience, she saw the potential of combining medicine with neural retraining.
Thought I would go back to Western medicine in some kind of organized fashion that had already been laid out for me, basically, right? So whether that was, some kind of independent clinic or a private practice with a group of fellow physicians, something that had been arranged for me ahead of time and I would get to join. To discover as I pursued becoming a certified MAP practitioner, as I learned more and more about energy work, as I learned more and more about the ways in which Western medicine was failing me, but also medicine was good at, what to change dramatically. I realized that I was going to return to something that was my own creation, that there was no way for me to go back, so to speak. I couldn't go back to the kind of physician that I was. I could carry the kind of physician I was forward. I could bring my knowledge and my experience forward, but I would not be able to return to kind of practice that wasn't my own creation. That led to my wellness center and medical spa, which is an interesting part of it because it includes all these aesthetic approaches. Which I think a lot of people think kind of don't go hand in hand. There's this feeling of like, well, how can you care about wellness if you're focusing on aesthetic? But that actually also came about in a very organic and very natural and really amazing way. And so all came together. I was able to open the doors to the wellness center in January of 2025. Still working through my MAP certification and the loose ends of all of that. A work in progress and has been, it still is. But I've now been open for 9 months and incorporating just all different kinds of healing now into how I approach patient care.
What I love about what Alia shared here is that she didn't abandon medicine. Rather, she expanded it. And this kind of integration is what creates true whole person healing, addressing the body while honoring the mind and emotions that shape our health every day. In this next clip, Dr. Alia Paquette talks about her view of internal medicine and how she supports all ages, genders, and states of health, and the range of what she offers in her practice, including MAP sessions.
My view of health, which comes from and is founded in internal medicine, right? So it's about treating all people. Internal medicine is focused on the health of all. Primarily adults, right? Like mostly our specialty goes into people in their 50s and 60s, but I treat people in their teens as well. I just don't do it from a pediatrician standpoint. I do it from the general health and wellness viewpoint. Now, bringing that foundation of internal medicine into what I now understand to be true about our human body and what we're capable of, and our ability to heal, the relationship of health and trauma, the relationship of health and perceived trauma, that mind body science and the mind body connection, being a MAP practitioner, it essentially has opened my ability to help people to include all. I'm here to support all ages, all, backgrounds, all sexes. It doesn't, like, there really isn't a limit from my perspective in who I would be able to support, especially because it's not just about me. Once they come see me, right? What I am trying to do is listen to someone's story, and then in listening to your story, I try to find out where you are in your journey of healing. What's your mind open to? What are you willing to consider? Are you a staunch Western medicine? I'm not going anywhere. This is the box I live in. Well, okay, then I'm going to talk to you about that from an honest perspective about what Western medicine has to offer. It's the parts that are helpful, the pitfalls, a true informed consent. So if you only want to live in the world of Western medicine, that's okay. I'm well trained in it. I'm well versed in it. I maintain my board certification in it. So I'm up to date on what they recommend. However, you won't just hear me say, take the statin. I will sit down and speak with you about the benefits and the risks, what comes with that long term, and how to mitigate those risks. So that if this is where you're going to live, in that box, in the world of Western medicine only, then I'd like you to still be informed and have your eyes as open as possible while you live in that box. If you're at the other end and you don't want anyone touching you with Western medicine and you only want energy work, great. I'm going to, again, talk with you about the pitfalls, the benefits and the pitfalls, because when we stay in one place in a box, we remove a lot of light from our life. And my goal ultimately is to try to help whoever this individual person is walk the path back and forth between, if you view health as a spectrum, which, it's not necessarily a line, but say you were going to make it linear just for that visual support, right? One end is the road is Western medicine and the gold standard and all of this amazing hard work we do to try to prove the theories we believe. And at the other end, you might see this world of what people call woo-woo, right? This like energy work and ancient medicine, which interestingly I don't view as woo-woo. It's it's changed in my mind. This is medicine that has existed for millennia, right? It's been there much, much longer than we've been able to understand. But because we can't standardize it, we call it woo-woo, or because it's presented to us in this culture, in American culture, it's presented a certain way. So we view it as different. But if you just view that as a path where along the way you may move from pure energy work into the world of acupuncture, into the world of meridians and chakras, into the world of MAP. I view MAP as being somewhere kind of in the middle. But looking at this mind body science, MAP has so much deep rooted science in it. And also it embraces the world of energy and mind body connection and the stuff that isn't as tangible, right? The things that we can't touch and feel quite as easily. It does such a great job of them meshing that all together.
So, if you follow what Dr. Paquette is saying, while medicine can address the body, MAP allows us to communicate with the subconscious mind, the part that actually controls our stress response, our immune function, inflammation, and so much more. What's remarkable here is that the MAP method doesn't replace medicine. It enhances it. It helps to remove those subconscious barriers that can prevent the body from fully responding to medical treatment or other alternative treatments. In this next clip, Dr. Paquette and I talk about the blind spot that Western medicine has towards mental and emotional issues, and how these can be the foundational issues behind our physical symptoms, fibromyalgia being one example.
You touched on a very important topic, right? When you talked about the blind spot, I think that Western medicine has towards emotional and mental issues, and not just of the variety that clearly require psychiatric care, right?
Right. Yes.
Western medicine sees patients as mechanical systems and leaves out the stuff that you can't see in a lab test, which is
Yeah.
emotional and the mental parts
Yeah.
of that. And clearly we are all of that, right? We are integrated beings. And so I think, yeah, a big disservice is done when we don't at least ask about what is going on in
Yeah.
people's lives and why this problem with their health now. What were the stressors in their lives leading up to this?
Yes.
Yeah, how can that be ameliorated as well as the symptoms that they are suffering with, right?
Yes.
Yeah.
Yes. And you're definitely getting right to the crux of the issue too, because within the world of Western medicine, we separate it so harshly that many physicians do ask trauma history, and many physicians recognize, like, yeah, trauma relates to what we experience in real time. And yet, often, then the accepted solution is to continue to keep them separate. It's not to, right? It's to say, what is your trauma history? They hear the trauma, and then the approach fails to acknowledge that that trauma is potentially presenting itself and manifesting in a way that is emotional or mental health related, right? In that traditional sense. And yet it may also be the actual key to the underlying physical symptoms you're experiencing. That often that what Western medicine wants to call a mental health disorder or a mental health diagnosis, it's the reason you have fibromyalgia. They're not separate. And the antidepressant that you would prescribe that may also have the benefit of reducing pain, awesome. If that helps, if that supports a person and they're not having side effect from it, great. However, for many, many people, fibromyalgia is such a great example of that. It doesn't help to give them an antidepressant that reduces pain. They are still daily trapped in a body that they feel is betraying them. They feel they have no control over and no say in what's happening. And the honest truth is, if Western medicine could acknowledge the deep and inseparable connection between our brain and our body, and stop trying to separate them as we treat and as we diagnose and label, we would stop doing as much harm. We could cause much more true health and wellness by recognizing the connection. And the crazy thing is, for Western medicine, they don't have to prove it. It's been shown by loads and loads of people that came centuries before us, right? There's all kinds of evidence to support this connection between the mind and the body.
Examples like this remind us that the mind and the body aren't separate. They're parts of one intelligent system that is designed to heal. By working directly with the subconscious, MAP sessions can help calm the nervous system, reduce emotional distress, and allow the body to move into healing mode. As we move into a new era of medicine, conversations like this are helping to shift the paradigm from simple symptom management to genuine mind-body healing. What I love about our conversation today is that it shows healing doesn't have to be either or. It can be both and. When we pair the precision of medicine with the wisdom of the subconscious mind, we give ourselves the best chance to truly heal. Remember, your body knows how to heal. And when you calm the mind and address the roots of stress, you create the conditions for real recovery. If today's conversation resonated with you, please follow the show, rate it, and share it with someone who needs to hear it. If you are ready to take the next step in resolving the subconscious stress patterns that keep you stuck in chronic illness, please visit our website for more information on retraining the brain for better emotional, mental, and physical health. You can join a free event or schedule a free consultation at tcneuralretraining.com. Or learn more about Dr. Paquette and her practice at reposewellnesscenter.com. Content of this podcast, copyright 2025 by Twin Cities Neural Retraining. Music by Barbara Ben.